With me now, Michael Cannon, Director of Health Policy Studies at the Cato Institute, and David Asman, my colleague at the Fox Business Network. There's a very bizarre section in this legislation which calls for the creation of a reserve corps. The president has the opportunity to take some people from the state National Guard and pull them into the federal service, to hire more doctors and have the doctors train to perform some type of indescript service. He talked about this on his way to the Democratic National Convention in July of 2008 when he would receive the Democratic nomination. Listen to what the president said he was looking for.
We cannot continue to rely only on our military in order to achieve the national security objectives that we've set. We've got to have a civilian national security force that's just as powerful, just as strong, just as well funded.
David, a civilian national security force just as powerful, just as strong, I'm quoting him now, just as well funded as the Pentagon?
You know, my son would say that. What's up with that? What's up with that? Just as well funded. That's $500 billion. Well, are we going to have two competitive systems, one that is uniquely political? Because, of course, our founders went out of their way to separate the politics from the military defense of our nation. This seems something directly tied into the political sphere.
Michael, does it work when the physicians are actually employed by the government, like in Great Britain? Because this program, this reserve corps that he probably was alluding to in the clip that we just ran, calls for hiring 6,000 healthcare workers and putting in some sort of a military-type organization that can be summoned by the president when he wants them.
Well, we already have a public health service that is like the military in some ways. The people who serve in it are commissioned officers. They have to be approved by Congress. The commissions have to be approved by Congress. And what the legislation would do is it would create a ready reserve corps, which is sort of like to the public health service what the Army Reserve is to the Army. In the case of some pandemic, the president would be able to call for these reservists in order to help contain the spread of contagion. I'm not really sure if that's what he was talking about during that speech.
But I'm not sure what he was alluding to.
He's got to explain something, though, because he says we need something in addition to our military in order to achieve the national security objectives. He's not talking about the Peace Corps, national security objectives. I mean, what is he talking about with that? Why do we need this other army?
All right, Michael, back to you. Does it work when the doctors are employed by the government, or is it a better system when the doctors are private providers of medical services who are reimbursed by either the government or a private insurance company? Which produces a better quality of health care?
I think that medicine always, like everything else, works best when you have a competitive marketplace, where you have freedom to choose, where you have low barriers to entry, where entrepreneurs can offer new and better ways of doing things. But what we're talking about here is how do we halt the spread of contagion? That's really what the Public Health Service is dedicated to. And there can be, I think, some role for government there, but I'm not sure that that should be a federal responsibility. I don't know of any evidence that the federal government would do a better job of responding to public health crises than state governments do. I think this is something that's best left to the states.
When the federal government, David Asman, imposes financial burdens on corporations that they would not choose to take in a truly free market, something I would argue we haven't had since the FDR years, but that's an argument for another time. Can that result in sending jobs overseas?
Oh, of course. It already has. There's this donut chain. What's the name of it? Tom's Donuts, which has just announced that they are going to set up operation in Canada because Canada has a better tax situation than we do in the United States. I mean, this is like 10 years ago, if you said Canada would have a more favorable tax code towards U.S. business than the United States, people would have said you're nuts. But that's what's happening now.
Michael, we have $14 trillion in debt. Does it pay to add more entitlement to that debt?
I don't think so. I mean, one of the main impacts of the Obama law is it's going to explode the deficit. Before it was passed, we heard lots of projections that the cost estimates are based on fantasy. Since that, we've had more people come forward.
And the projections since then are just as bad. Michael Cannon, David Asman.
The New Yorker has said that it's going to bust the budget.
You're right. Thanks very much for joining us. A lesson